Adventures in Colorectal Cancer, 2026, July 27th. So this Friday, I talked to the medical oncologist and told him that it was the last time I talked to the CR surgeon, the colorectal surgeon, was the 22nd of June. And so he was going to ping him, and then he suggested I call the office, which I did. And the CR surgeon isn't in his office today. He's probably up at the hospital then. So I got the receptionist and I asked her what the status of my case was before the review board. Now, apparently, you go on a list. There's only so many cases that are discussed every Friday. And when the case comes up, the case comes up. And until then, the case doesn't come up. I'm not sure how they triage this, because there must be cases that are, some are more urgent than others. And apparently she thinks there was a discussion about my case on Friday, but she's not really sure. And after a lot of her talking in circles, generalities, she basically said, tomorrow when the doctor's in, I'll ask him what the case was, what the disposition of your case is. I also told her about the thin blood streak on the outside of my toilet paper on Saturday, and she said, oh, she'll bring that up with him tomorrow as well. So yeah, so here we are, waiting on another phone call. I'm not surprised at this, I guess is the way it goes, because this is Fraser Health talking to the clinic in Coastal Health. The two systems don't talk to each other. The two systems are competing for government funds. And so they really don't, so I imagine there's some politics that are going on between the two that I'm unaware of. But yeah, so it's just crazy. I have a friend that just had surgery for women's reproductive cancer, and all of a sudden now she's got to hone up on medically induced menopause because no one told her. Well, it's kind of obvious when you have your reproductive, when women have their reproductive organs removed, that they're going to wind up into medically induced menopause. But it's one of those things that just kind of gets missed or dropped or not talked about. It's just like, oh, when you remove your rectum, holy crap, holy shit, you've got a whole change of life around that, because your rectum is no longer sort of the receiving bag for your colon, and your colon's just going to do what your colon's going to do, and you have to be prepared for that. However your body readjusts to it. And it's almost like the system needs paramedicals to be on your side, so that you know what questions to ask, when them to ask them, what are your options, why are you doing it this way? Because as a layperson, I don't know. I'm trying to trust the doctor, but based on my cancer camera design stuff, I really don't trust these people, because they really don't always have my best interests in mind. Especially talking to the ex-head of cardiac surgery at one of the local hospitals, and the stories, he was telling me about, they hospitals don't want to give up patients because then they can't get a bigger chunk of government funding. If they send a patient off to another hospital to get treatment, then they lose. Then they can't plead for the next budgetary round that they need this money. I don't think they'd let me die, but they certainly may not give me prompt treatment and use me as a pawn. So yeah. Anyway, making appropriate life decisions. You don't make any money, but you get good stories.